Brian Walusimbi, for the last 6 years, has run a home that offers treatment to children with cancer. When I handed him this draft report, his reaction captured the imagination of one that has seen children with cancer risking their death throes.
Ooh, retail even.
Sold in the market, the variance is 81,000. So if you went to use a 17-page audit investigation on the supply and distribution of cancer drugs to the Government Cancer Institute reveals shocking findings. Amongst the audit revelations is overinflating the cancer drugs, which led to the loss of over 2 billion shillings. 2 billion shillings can cater for the treatment of about 1,000 cancer patients of Burkitt's lymphoma, a curable cancer. The audit sampled 11 types of anti-cancer drugs supplied to the Cancer Institute in the financial year of 2015-2016. It opened up a murky window into the inflated prices. Despite the Cancer Institute grappling with over 90,000 patients requiring procurement needs of up to 12 billion shillings in 3 years, national medical stores maintained the budget at 7 billion shillings, risking the lives of patients at the Cancer Institute. In June this year, a patient's attendant raised red flags over the prices of drugs at the Cancer Institute, which prompted an internal audit sanctioned by the Secretary to the Treasury, Keith Mwakanizi. It is the findings of this audit that NTV has now obtained. Prices of some vital drugs like elotinib, which treats the small cell lung cancer and pancreatic cancer, were overpriced. According to the contract price, elotinib goes for about 1.2 million shillings, but was sold at 12 million shillings, a price variance of 11 million shillings per unit. Another drug, rituximab, which cost 3 million shillings, was supplied by NMS at 7.4 million, resulting into a price variance of 4 million shillings. The audit points to a likelihood of collusion between officials at NMS and the supplier that resulted into the loss.
It is definitely a shock and a huge disappointment as well, because, you know, we are doing the best we can to save lives, and especially when you know that you're putting all you have and somebody is making a huge killing of it. It's a huge disappointment.
Despite overpricing the drugs, flouting procurement procedures, and causing a 2 billion loss, the audit also found that NMS supplied less than 50% of the essential drugs that they overpriced, forcing cancer patients to get them at counters of private clinics or stay their medication, leading to progression and, in some cases, death. The audit also reveals that despite the supply shortfall, NMS in 2014 registered a closing balance of 1.7 billion shillings on its account books. In 2015, NMS also had another unspent 1.3 billion shillings, and in 2016, they have not spent about 500 million shillings. During an interview with NTV in August, the NMS General Manager Moses Kamavari blamed the Cancer Institute for the mess in the supply of drugs.
This time around, I have communicated with the Director of Uganda Cancer Institute, rejecting his procurement plan which he sent to national medical stores for this financial year. Why? One, as we had said earlier, every health facility gives us their procurement plan for NMS to plan to get for them what they need early in the year. By May, we should have received that procurement plan. That procurement plan reached national medical stores in July.
A robbery by any other name would be called a haste. And what this audit report is saying is that there might be a haste in the procurement of drugs for a disease that kills almost 21,000 Ugandans every year. Raymond Mujuni, NTV.